South Africa is one of those countries that has recorded several monkeypox or MPox cases, and there have now been 13 of such cases confirmed so far. The World Health Organization first announced that the multi-country outbreak in 2022, and since then, over 180 people have died from the disease. Nqobile Madlala has more. She's actually live to me this morning. Sorry, Nqobile. Good morning. We don't have your audio yet, but just let our viewers know exactly where you are. And this is a concern. We heard you talking earlier on to one of the health officials about tracking the source of how this came to be in South Africa. And that's something that health authorities and officials are still grappling with.
Well, yes, they are still trying to figure out how it got into the country. Most of the cases that they've recorded, Iman, have shown no travel history. So they have said that now their focus is to ensure that they prevent the spread of the disease. At this point, we know that most of the cases have, at this point, that they are working with it. And they've also shown signs that most of the cases are from males at this point. But they're still trying to work it out in terms of how it came into the country. And because of that, they have to ensure that the people that are coming into the country are scanned and that they can be seen just in case they are having these cases. So at this point, we are at the airport. We've got BMA, which is part of the organizations within the government that are working around the clock to ensure that that spread is prevented. I want to bring in BMA now to speak to us about how they're doing this, because one would have thought back in the days with COVID, you would have a scanner, you would have all these things. Have you put anything in place to ensure that anyone who comes into the country knows about this disease and that can be tested?
Yes, mornings to the listeners as well. We do have systems in place. As you know, with our airports, we already had the scanning systems, that is the thermal scanners that detect the temperatures as the first line of identification, of which, as we know, this is a disease that is also associated with fever, like your COVID-19 and other diseases. So once temperature is elevated, such people, we isolate them and observe them, as well as if there is a need. We've got arrangements with both the ambulance services within the Department of Health, in the Gauteng Provincial Department, as we are here in that area, as well as the private ambulance services. So they will take our patients to the relevant health facilities who will isolate and further manage the diseases going forward.
And I mean, I know that at this point that you haven't seen a case specifically in the airport, but there is a concern because, I mean, we've seen the spread happening areas like North America and Europe, and because there's a lot of movement between the countries, I can imagine that there are certain maybe areas that you are concerned about at this point.
For us, it's largely our airports, because most people that travel from most of the countries that are affected now, as we speak, would usually come into South Africa through the airports. Where we are now in Lanseria, it's both an airport for normal traveler use, as well as for mercy flights. So patients that comes from other countries with other conditions for procedures in South Africa are taken in through here. There is a flight that we're waiting for now that is also a mercy flight. That can also be a source of a transmission into the country. But with the systems that we've put in place, there isn't much that you can do, because it's largely on observation as whether there are lesions or whether the scanner shows the temperatures that are elevated. Then we take it from there. And we are, as the BMA, of course, depending us as well to say for those cases that in those unlikely events find themselves entering the country. Such people, what we do as people come in, they're informed that if you've got symptoms, you need to communicate or you need to access the nearest health facility so that they can assist you.
And of course, because it goes far further than the airport. We've got so many borders in this country that people are also entering from. What we have learned is that the spread also is within the Central African areas as well, region as a whole, which means that those that could be in a bus or a taxi or even in a private car coming into the border could also have a source of transmission, or the source of this disease. How are you controlling the land borders?
The approach is the same, and the good thing is that coordinating these things as the BMA, it becomes easier, because we consider our operations as that follows the single command and control. Whatever is done here at Lanseria is being done at Beitbridge now as we speak. Most of the buses that will come to South Africa from the Central African countries, they will come through Beitbridge. Some of them will come through Groblersdorp, but immediately when you get into the northern border side, gate of the border, Port Health officials will be the first people that they will come across, and these people will be scanned for temperature, for thermal differences from what is expected. So the approach is the same. If we find any of such, they will be isolated and then they will be referred to the nearest health facility should they be considered to be suspect of the infection.
Thank you very much for speaking to us. That is the border management authorities. Already at the airports, Iman, they're saying that there is a great concern, obviously, the airports, because there's a lot more people that are coming in. But also they're saying that in borders like Beitbridge, they're also keeping a watchful eye. The best thing that they are doing currently is distributing some of these that basically explains to people the importance of hygiene. If you remember, during COVID, there was this emphasis on making sure that people wash their hands. There is a great emphasis now that people must wash their hands and that they must have an increased hygiene. But at the same time, if you consider yourself and think that you could potentially have, it's important that you go to the hospital. Don't go to the pharmacy. Go to the hospital, hand yourself in so that there is a track and tracing team can be able to start working with the people around you.
Nqobile, thank you very much for that. And we'll actually look a little bit deeper into the story as well on the issue of MPox in South Africa.